On this program, we've spoken a lot about the heroin epidemic that is plaguing our area. And that was the focus of an educational forum at Pace University in White Plains last night. Our own Dominic Carter, he was there, and he caught up with some of the folks who participated, including the U.S. Attorney PREET BHARARA.
An unfolding crisis throughout America. In some cases, abusing opioids starts in pill form, primarily painkillers. And then it turns to much cheaper heroin for financial reasons. What was perplexing? The faces in this crowd. This opioid crisis is devastating mainstream America. The federal prosecutor, PREET BHARARA, who appeared on the cover of Time magazine and recently brought down two of New York's most powerful politicians, is promising the same fate for drug dealers.
If you are a clear-eyed, cold-hearted dealer, not an addict, but a dealer who peddles poison to people after learning about overdoses from your drugs, we're going to come after you hard.
Mr. U.S. Attorney, you're known as Elliot Ness in terms of what you're doing with public corruption, but you're here tonight on opioids. And it really touched me when you played that 911 tape of a mother in desperation that lost her child. How bad is this problem? You're on the front line.
It's awful. It's an awful problem, and it affects every community, whether you're in a wealthy community, a working class community, or a poor community. It affects communities in the city, in the suburbs, and in rural areas. No one's immune from it, young, old, middle-aged. It's been a long time, as you heard in the panel today, since we've had a problem that is so sweeping and not getting better in the immediate future unless not only we have great prosecutors working on these cases like my office has, but also members of the public, the medical community, people who understand how pain works, how addiction works, how treatment works, to work on the problem also. It's not going to get better unless everyone's working together to bring down the number of deaths. I mean, the number of people dying from this problem is at an all-time high, multiples of what it used to be, and it's because it's gotten out of control, and we need everyone to help to bring it down.
An opioid is a type of drug or medication that goes to this opioid receptor in your brain. And so it includes things like oxycodone or hydrocodone or Vicodin. It also includes things like methadone, fentanyl, and heroin.
Dr. Abigail Heron is on the front line, dealing solely with treating addiction. She is the director of psychiatry at the Institute for Family Health in New York City. People are literally dying.
Absolutely. So poisoning deaths or overdose deaths have now increased to a point that more people are dying from overdose than are dying from motor vehicle accidents.
Are you serious?
Absolutely.
When we talk about DEA, it's so much Hollywood and so on, and you're the head guy in New York. When it comes to opioids, what is the hardest part of your job?
The hardest part of my job is coming to an event like this and hearing the stories of parents who've lost kids. By far, that's the hardest, the saddest part of my job is hearing the end result of some of this, what this garbage is doing to families.
My son at 17 started to use all kinds of drugs. He became addicted to heroin. We sent him to rehabs all throughout Florida, California. 5 times overdosed, saved with Narcan multiple times thanks to Senator Carlucci pushing for the Narcan.
Susan Quinones lives in Rockland County and is one of those parents with a heartbreaking account. You don't seem to be the face of a mother that's dealing with someone with drug addiction.
I think that's what kind of fooled the pediatrician, although now we need to know the face of addiction is like the Salamone's face or any of the people here that you wouldn't expect. I've heard people say if that could happen to that family, it could happen to anyone.
And this is proving to be an epidemic that does not discriminate. Susan Quinones is one of the fortunate parents. Her 17-year-old son Raymond lived and is now in his early 20s.
And with that, let me bring in Dominic. First of all, we'll get to some of the policy changes, let alone the U.S. Attorney, but what stood out to you? Because it wasn't just the officials at the front of the room. You had real raw stories from families, too.
Richard, I'm really glad that you asked that question because as a journalist covering this, it was very emotional. oftentimes we get to see things, we get to witness history quite a bit, but the human toll that this is taking on families, Richard, I did not understand the scope of how devastating this is. One, to deal with addiction, as we both know, you've covered this much longer than I have, it's tough on the individual, and perhaps it's as tough, if not tougher on their loved ones. And so to see these families, and the folks quietly arrived. Yeah, you're right. The feds were running the show, but the families quietly arrived at the law school. They were patient. They waited for the event to start, and it was just a passionate, emotional conversation on the human toll of the devastation of what these drugs and drug dealers are doing to families.
And all different colors, all different backgrounds. This is suburbs, this is cities, this is even rural communities. That's the thing that I haven't seen about this before. I mean, you look at crack, for example, and sure, you had people using it all over the place, but it was primarily an inner city drug. Heroin, I mean, we remember, when somebody was on heroin in the 70s, you had to be the last level of a drug user, street junkie. Now they're finding it in high schools. I mean, suburbs, it's all over the place.
Richard, as Mrs. Quinones, I'll never forget her, one of the people that we profiled in the piece that we just saw, Rockland resident, and here was the common denominator, Richard. My child, anywhere between age 13 and 17, for recreational use, or maybe it was part of their, the part of their DNA. I don't know if that's possible, but they craved the drugs and they wanted to try the drugs. And once you go down that road, Richard, I almost watched the DEA guy that you had on the program live from there last night. The man almost broke down in tears at the end of the event. He was literally shaking. And as he said in the piece that we just aired, we didn't show the part of him shaking and getting emotional. He said that listening to the families, the human toll, he said, I've been doing this for 35 years. He started with NYPD, Jim Hunt. NYPD moved over to DEA, doing this for 35 years. And he can't take it because he was there just like the rest of us listening to these families. Richard, I can't, I'm not doing a good job enough of explaining the emotional impact of being in that room last night.
And the numbers, people who do this from law enforcement, throughout the judicial process, from the cops who are now having to do not just arresting people, but they're executing life-saving, treatment to try and bring these people back when they've had ODs. They're trying to get them into drug courts. They're being therapists. They're being counselors. Too much we're asking of law enforcement. And then you have the families. You have this all up and down the food chain. And it doesn't matter the politics. People said it's not working what we're doing. Now, to that end, you had the U.S. attorney taking the unusual step of saying, by the way, counties, thanks, but now we're going to take it on when we're talking about a big drug buy or big drug bust, I should say. They're going after the dealers. Why?
Well, I think because the impact that it's having on America. This is not a local problem. It's not a regional problem. It is a national problem, unfortunately, coming to an area near you. To people that are watching us right now. I came into this assignment going, okay, well, heroin, and, it's been around. We've covered this a very long time. And, some of the young people, and I'm not trying to minimize it. Some of the young people, they do it recreationally, and they may come out with habits. But, Richard, we're talking about kids dying. They started the event last night with a 911 tape. I will never forget it, of a mother, hysterical, calling the police because her 14-year-old child, had just OD'd in the bathroom. And she did not know what to do. And when you have heard the pitch of a mother, when it's beyond tears, she's hysterical and does not know what to do, how to react. And 911 is trying to calm her down. And she was not coherent. She was just screaming into the phone. Her child died in that bathroom.
Listen, I've said this. I saw after 9/11, we saw unity because there was a war on terror at that point. I have not seen until recently politically people of all different stripes, whether you're, regardless of where you are, from the officer to the town priest, to the judge, to the hospital, to the parents, and everyone else in between, educators as well. There's unanimity here that we have to treat this as an epidemic, and we have to get these people help here. So it's interesting. It's also interesting where the U.S. Attorney is going on this, and this will not be the final forum that he'll be hosting on this. Dominic, thank you very much. All right, we pivot now from what is, as Dominic says, not a local, regional, even a national story, to what is now an international story, and that has to do with a right-wing populist wave that is now hitting Europe and what it could mean for the United States. A hugely important vote this Sunday in Italy. We'll tell you about that straight ahead.